Yeah, matter as a Christian and a system professor working in research college of Physio. In the last part of the video, we are seeing about what is stroke and what are the causes for stroke, and we are see about some about type like a thromboembolic stroke. Now we are going to discuss the later part of the today's in this. There is already thrombosis, what is thrombos, what is emboli. See here the stigma emboli from coming from the product body like a DVT. Yes. Then the next type will be hemorrhage. If it occurs due to the rupture of the blood vessel in the brain because of the hypertension or because of the any head injuries, it is called as the hemorrhagic stroke. The hemorrhagic tissue that occurs due to both ischemic and mechanical injury to the brain substances as a result of the condition. It usually occurs either due to some of the risk factors, like we already mentioned. See how the hemorrhage is took occurs. Hemorrhagic means blood vessel got ruptured and bleeding from the internal part of the brain occurs. If part of the brain is rupturing and the bleeding occurs inside of the brain, then the particular part of the brain not getting blood supply. Then the another type is called as the transient ischemic attack. The transient ischemic attack is a mini stroke, like we are saying. It will the symptoms will last for only 24 hours. If the patient is going to get a full stroke, then it may be a first starting point of the stroke. If the person's awakened in this stage, then the person may not getting any stroke in the near future. It is the embolism of the thrombus or platelet material from the extracerebral artery, especially the internal carotid artery, which is origin in the neck. Symptoms last for only few minutes. Usually, it will go in the next 24 hours or nearly to the 1 week or 10 days. The exact pathology of the ischemic stroke is if the presence of fat and more fat deposition in the artery, then it leads to the plaque and it narrows the cerebral artery. If it interrupts the cerebral artery, the blood supply to the cerebral artery interrupts. Then the brain cells can't get the blood. It gets the poor blood supply. And the ischemic changes takes place in the brain. When the ischemic changes take place in the brain, it's the plaque which is mentioned. It is the narrow part of the. It is very narrow part, and the block is going there. Uh, the blood can't enter that area, so it becomes the ischemic stroke. If in the hemorrhagic stroke, due to presence of blood vessels, the compression of brain tissues occurs, and it extends to the hemorrhage. The hemorrhagic stroke picture shows that clearly. The weakened or diseased blood vessel getting ruptured. In the clinical features, we're going to see that if a person is getting affected with the stroke, the persons will get the hemiparesis, like say, he can't be able to speak or he can't be able to swallow like this page I can't able to speak like this arthria. He may get bowel and bladder impairments, he may get psychological dysfunction, he may get pain, pulling of saliva will be there, breast drop, food drop. What is the difference between hemiplegia and hemiparesis means? Hemiparesis is mild power changes in the motor level, but in the hemiplegia, the patient won't get uh, any power in the maximum the MMT will be is 1 minus of 0. The muscle tone will increases according to the brainstorm approach, brainstorm classification. Then the reflexes get increases, ataxia, hemisensory loss will be there, loss of consciousness will be there. The patient will having sometimes starness. The patient will also getting weaker due to that. And after that, if you are going to start stroke, if you are going to see a stroke in your near future, you have to rule out these symptoms like be fast, we will say, uh, like in we have to do a memory test. We have to be memory like be fast. Be fast. We will explain this in the next part of the video. What is the be fast and what are the treatments of the stroke? Thank you.